Good morning, everybody. We have been meeting at least once in a year through this forum called Nucon, or National User Conference. And I'm very proud to be here addressing and welcoming all of you. Approach us, we are here to serve you. We are not here taking up too much time. I would rather give an opportunity to all of you to listen to Mr. Shopman, who has been working for healthcare providers for a long period of time, to sort of give a keynote address and kick off the conference with the theme of risk management and EHR implementation. Again, I'm very glad to welcome all of you, and please feel free, this is your own conference, and mix with everybody and let us know what we can do. So it's, please take over from here and enjoy and participate in the conference.
We'll jump right into it. Some of these for you, because you're a much more sophisticated audience. Normally I speak to physicians and medical practices, so I have to bring it to their level to actually get them. And you all in this room who are doing this every day should love me, because I get up in front of doctors and tell them, A, you're doing it wrong, B, you're doing it wrong, and C, you need someone who knows how to do this well to do it right. So what we try and talk to them about starting, how do we retain records? How do we physically retain them? Well, when I do this talk with physicians, most of you see it every day. You see, how are most physicians' medical practices backing up their computer systems?
So what is an ACO? An ACO is a provider-led organization whose mission is to manage the full continuum of care and be accountable for the overall cost and quality of care in a defined population. That's what the overall sort of thought process is.
The focus of this talk is not how to achieve PCMH, but what iPatientCare did for us by time reviewing charts. Or we could make friends with our computer guys, and that's when I spoke to Ryan and asked him if they were willing to commit resources to developing certain modules which were not available in iPatientCare at the time, and that's where we have come, is where we decided to do that. Now, after we did our analysis, we realized that there are lots and lots and lots of reports that NCQA requires us to submit, and we could do that with the tools that we had at that time.
So what they did is that my hospital decided 85% of the total cost of software. That's a lot. We have 4 people, and the software might cost about $40,000 minimum, and some of the AHR companies are even much more expensive. This was probably the least expensive of all. So let's say if it cost me $35,000 to buy the software for 4 people, $30,000 the hospital pays. So I only have to come up with $5,000, and we can have the EMR for everybody in the office. And the hospital also has another big interest, is that once you admit it, then you're going to use their other inpatient services also. Like you order CAT scan, you order MRI, you order EEG, you admit the patients. So all other facilities you use, which are provided by the hospital. So with regional alliances, they are attracting.
These lists to you. A little bit different in Medicaid, allows for nurse practitioners and physician assistants. And here's how they work. If you want to apply under the Medicare policy, you need to show meaningful use for a 90-day period. At the end of the 90-day period, you will attest that you have been compliant and you're done. Every year thereafter, you have to be compliant for the entire year. If you fall off the bandwagon, you're done with the Medicare incentive program.
Who are the business associates to take care of accountability? Now, the second view, the patient point of view. Do patients really care whether their providers belongs to on-premise model or hosting model? Or what are the patient perceptions of the IT security in healthcare, such as who patient trusts to view and manage their personal information? What patient considers to be personal information? How they think that EHR will take care of the privacy and security of their personal information? How patient will likely to respond to security breaches? What steps healthcare organization should take to prevent a new information technology security requirement from the transition to